Breast augmentation is the #1 cosmetic surgical procedure, and Dr. Mark Crispin has become established as one of the top breast surgeons in Atlanta. Meet Dr. Mark Crispin as he discusses the most important information every woman who's considering this procedure should know.
My practice is as a plastic surgeon, and what that means is that I'm involved with cosmetic surgery of the eyelids, of the nose, of the face, of the breasts, and also with injectable type things that are not surgical procedures but adjuncts that we can do in order to make people look more refreshed. My training is as initially a general surgeon, followed by a board certification in plastic surgery, and then I took an extra year going to New York City, doing a cosmetic fellowship at Manhattan Eye, Ear, and Throat Hospital, doing exclusively cosmetic surgery for the entire year. I started practice here in Atlanta 15 years ago. At this time, a very common procedure that I see in my practice and patients come to ask about in my practice is breast surgery. Breast surgery both in breast enhancement in terms of size, breast reduction where the breast is too large and the patient wants the breast smaller, and frequently, particularly after childbirth, depletion of the breast where the patient wants a lift or mastopexy. All three are very common and something that I see frequently in my practice. Well, it's very important to customize each implant in surgery to each patient. Everyone comes obviously with a different breast size, and everybody comes with a different chest or thorax circumference, and it's very important that the implant fits nicely, that is to say the base of the implant or the footprint of the implant fits appropriately on the footprint below the breast. What that gives you is a much more natural look. Think about the patients or perhaps the people that you see that have very large implants where the footprint mushrooms out to the side. It looks very unusual and very implanted. And the hope is to give a nice natural look. In order to do that, you need a much better fit to the thorax or chest diameter. The #1 determinant regarding size of implants and type of implants is the patient's preference. They will tell you what size they want to be frequently. They have famous people they reference or even bring in pictures for breast sizes and shapes they like. So first and foremost, you need to listen to the patient. That's extremely important. Additionally, you need to take some very specific measurements of the breast, the base of the breast, so that you can customize the appropriate implant to the appropriate breast diameter. There are two different types of implants basically used in the United States. They're saline or silicone gel implants. Some people do better with saline, some people do better with gel implants. People who are particularly thin tend to do better with a silicone gel implant because the implant has a more natural feel to it and they have very little skin envelope on top of the implant to be able to camouflage that. Someone with a bit bigger breast and with someone that has a larger skin envelope or a thicker skin envelope can use a saline implant. Breast augmentation is now a very accepted procedure. The patients that I see in my practice are simply women that want an improvement in their figure, want to balance out the way they look in a blouse or the way they look in a bathing suit. For years, the concept of breast augmentation brought to mind the thought of a very, very large-breasted woman in a bathing suit, sort of that old aesthetic. Well, that's not necessary. In fact, that's not my practice. That's not the type of patients that I see. I see people who want a nice natural look, whom it's difficult to tell if they're implanted or not, so that they have a nice, pretty confirmation about their breasts and they feel good about the way they look in a blouse or a bathing suit.